VAHS is now mainly shifting this around population health promotion approach, and how do we convert community, how do we integrate community engagement, health promotion into actual service delivery. So that's where VAHS is now taking that shift at the fact that the sad reality is it's not just a VAHS thing, I think it's just a general thing in Australia. The only time mob access their GPs or their AMSs is actually when they're sick. So how do we shift the mindset with our people in our community to utilise their local primary healthcare provider on a regular basis? So that's where VAHS is now looking at how do we engage with our community on an ongoing and continuous ongoing approach for mob to utilise their service on a regular basis. So one of the main things we do is that what we're trying to get people to understand is actually annual health checks. So the sad reality is that not a lot of people just come in here and say, I want to get a health check done. Again, people only come here when it's at crisis point or when they're crook. So how do we get people into the service on an early stage to assess their own health and check out what are the risk factors that could lead on to a potential health problem? Yes, it is mainly around mental health, but as VAHS we look at the holistic approach of the person's health. So it's obviously their physical, their mental, their social emotional, but also their family health and financial health. We actually put financial health part of primary health. So we see that people who are in the financial burden can lead on to poor health outcomes. So that's why we have the Sheriff's Office here on a regular basis. So we make a comfortable experience for our people to come and sit down with the Sheriff and go over their fines and any outstanding fines they do. So not here have the handcuff ready. No, we sit them down, look at their current situation, and then they'll look at, all right, what's the best way moving forward with a payment plan, or is there any ways that the Sheriff can actually look at maybe remove some fines, but not just entirely, but let's just minimise it, but you still have the accountability, you still have to own up to some. Centrelink is another one, so we make sure that we have a good relationship with Centrelink as well, so Centrelink comes in and provides that advice to our people, but gambling is another big issue as well with our people as well. So gambling can lead on to a lot of poor mental health outcomes as well. So we actually have a big emphasis around gambling, and we have financial counsellors as well. Another one, if their bill's going to get cut off. So they're getting the letter from the gas company or the power company saying, you're not on top of your bills, we're going to cut it off. So what's that going to lead to? More problems. So they actually seek advice and support from our financial counsellors and basically say, look, we'll negotiate with the utility companies and look at how do we keep your utilities going, but as well, let's look at moving forward in terms of having a minimal payment plan as well. So we look at financial health as a big issue as well with our communities, because the majority of our community are unfortunately in low socioeconomics. Okay? Another factor we do is daily choices. So you may have heard of the successful social marketing initiative that's came out of southeastern Queensland. And southeastern Queensland is obviously it's Brisbane and the Gold Coast, a very urban, dense area. So VAHS, obviously Melbourne, same situation, same environment in the urban. There's how do we do more around community engagement and marketing to our community in this particular environment. So that's why VAHS have taken on the Deadly Choices campaign. And since the campaign has been implemented here at VAHS, and the statistic shows that in the last 3 financial years that we've had over a 68% increase of health checks with our community. So, and also part of that is that we go into the schools and we do brief intervention education to our young people, and we do an 8-week leadership program educating our young people around the risk of chronic diseases, but also the best way to prevent a chronic disease. The main core fundamental is about teaching them about primary health care and the Medicare system. We've got to get our young people more familiarised with the primary health care system so they actually can utilise it more often. Again, we're trying to shift that mentality, don't come here when you're only sick. So what we're trying to educate kids, especially around mental health or poor mental health, is that, and I think it was, you mentioned earlier, that we all get sad a bit and we're all feeling a bit down and we'll have, poor mental health here and there. But it only deteriorates to more severe mental health if you don't treat it on an early onset. So that's why we're trying to educate our kids, is that if you're feeling a bit sad and you're feeling a bit down, but that's where a health check can identify those things. And then our clinicians will refer you to the appropriate services that you may need based on what you've identified. Again, because people aren't coming in here when it's crisis point, because they haven't left it treated. So that's the engagement, what we do with our young people, is get them familiarised with the primary healthcare sector, especially the AMS sector. This is their health service, utilise it. Don't come here when you're sick. So that's the approach that VAHS are doing. In terms of the forward growth, because our population is quite growing here in the Melbourne metro region, so we're very fortunate that we just recently opened up a satellite clinic in the northern suburb, which is the majority of our clientels are based, but also the evidence shows that there is a huge population growth in the western corridor as well in western Melbourne. So VAHS's next approach in the next 12 to 24 months is actually open up another satellite clinic in the western suburb. The best way, the problem is that they're saying, oh, we need to close the gap, we need to close the gap. We don't believe in closing the gap here at VAHS. We're about increasing the quality of the life. All right, we don't believe in closing the gap. It's about increasing the quality of the person's life and the family's life. Again, what Uncle Alan has mentioned before, strengthen that family. If you strengthen the core of the family, then you have better outcomes for the whole family structure, and then you have better structures in the community as well. And the problem is that the reason why there is a low health outcome for our people is because of the lack of access to primary healthcare providers. And we know that the evidence shows that our community are more likely to go to an actual community-controlled Aboriginal medical service. So we've got to start now branching out to where our communities are, because yes, back in the day, they all congregate here in the inner city suburbs of Melbourne, especially here in Fitzroy, but now our mob are now moving out more out into the burbs, so we've got to start setting up clinics out in the burbs where our population is. If you put the clinics out there, then they will come, basically. So that's it from my end, from a preventive point of view. We really like to thank you all here to be at the Victorian Aboriginal Health Service. It's a very historic site. It's the site of many other events as well, especially the NAIDOC March. We get up to 10,000 people that can jam into this building, but we do it as well. But we also like to incentivise our people too for doing the right things as well. Given the partnership we have with the Essendon Football Club as well, is that we like to incentivise our clients for getting on top of their health, attending their appointments, attending their health checks. We want to incentivise our clients and reward them for doing what we want them to do, is be on top of their health. So thank you everyone, and hopefully you're all warmed up. And that's it.